please welcome to the stage Dr. Akiba Green.
Thank you. You guys hear me okay here? Well, what we're going to do is we're going to go through and I'm going to talk about some of the basic concepts behind chronic health conditions. If I can get a show, and we've got a nice little group here, how many of you are currently suffering with a health problem that you're not quite getting answers to? Okay, great. So this is going to make a lot of sense to you. You're going to learn a good bit of information, but I really have 3 goals for all of you today. Number 1, and most importantly, my goal is to reinvent your life. I'm here to give you information that can make a change, that can allow you to take those steps that you need to get the answers that you're looking for. Every human being that I come in contact with, my patients, my friends, my family, the community, it is my job to add maximum positive impact. And I really try to do that through my education, through my practice, through just trying to give people the information that they need. The biggest thing is by the end of this morning, by the end of this lecture, I hope to be able to have an exit strategy that you guys can take to make those next steps. Now, how many of you are sick and tired of going to the doctor only to have nothing truly done to get results? Sure. So what I know right now is the doctors that you guys are seeing don't know what they're doing. They really don't. And it's, you know, if we talk about how many here have been suffering for more than 5 years? Sure. So if you had a health problem, your doctor was able to know what he was doing and correct that problem, maybe 6 months and you would have been fixed. And you know, that's why I know he doesn't know. But there is a reason. And you know, you've been living with these problems for so many years. If we talk about why your physicians don't know what's going on, the overwhelming majority of doctors don't read research. In a modern insurance mandated world, they don't have time to know what's new. You know, as I was introduced, mentions I go through 300 hours a year. This year I hit 308 hours of continuing education. That's a lot of time away from my friends, my family, my office. And it gives me the information that I need to help figure out how to get you better. There's simply no time for the majority of your physicians to do that. They rely on what they learned in school. That information is 15 years, 20 years, 30 years old. My textbooks, 15, 20 years old, were actually written and have information in them almost 40 years prior to that. I mean, literally, it's outdated information. It takes that long for something to get to the end textbook and then into the doctor's hands. And we all know fish oils are beneficial. Over the past 5 to 10 years, we've seen a prescription fish oil, Lavazza, come into play. Before that, we would have never thought about using fish oil for anything, yet the research has been there for 50 years. You know, it takes time for this stuff to trickle down. The key thing is, there's only one thing that really matters when it comes to your health. The only thing that really matters is results. And you guys aren't getting any. And so what we're going to do is we're going to talk about how we can get your results. One of the things you have to keep in mind is when you go to your doctor and you're not getting results, the reason you're not is because you're not going to him because you're good. And I'm going to wait 1 second to let him finish. Or if you guys can hear me okay still, are you guys good? Okay. When you guys go to your doctor, you're going to him because insurance covers them. I mean, let's be honest. You're not going there because you're getting better. So if we talk about that, you know, you have to look and say, well, how can I get the information that I need? What can I do to improve my health the right way? If he doesn't know what he's doing, and he never will, then we have to talk about where is your health problem coming from. And if you guys want to write something down, there's one term I want you guys to learn more than anything else today. You are all suffering from what we call a web of physiological dysfunction. None of you in here has just one health problem. Now, you may come here because of thyroid disease. You may come here because of diabetes or IBS, or you can't sleep, or infertility. It's not just one problem that you're suffering from. You have this web, and when I talk about a web, what I'm really talking about is a myriad of different things that are contributing to the symptoms that you deal with. You know, again, you may have liver problems. You may have blood sugar problems. You may have emotional issues or stressors. Your brain may be misfiring. We talk about anemia. You talk about gut issues, adrenal or hormonal imbalances, thyroid problems. All of this together leads to how your body reacts. So much of this has to do with our immune system and how it interacts with everything in our body. And if we talk about how we're going to address your web of dysfunction, it looks pretty confusing. There's a lot that goes into it, and it's no wonder that when you go to your primary doctor or your specialist, they're looking at one little piece of the pie and they can't figure you out. They're not looking at the whole person. Many times doctors give up on you. They pass the buck and say, go to another specialist. I mean, I see this so many times. It's, you know what, you're going to go back to the doctor and say, well, I've already done that. Well, you're going to go back again. I've already done that. And people are stuck. If we don't address some key specific areas, you're never going to fix your chronic health problems. You're never going to fix your autoimmune disease. And we're going to have to look at 6 different areas that really have a lot to do with why you are suffering. First and foremost, we're going to talk about your gut. Now, gastrointestinal tract, we're talking about the colon, small intestine, stomach, and liver. Even Hippocrates, if we go back to the father of medicine, said, look to the gut, there you'll find the cause of almost all human illness. This is not new information. But if we really talk about it, our immune system, and we talk about autoimmune disease specifically, up to 80% of our immune system is in our gut. That's a huge, it's called enteric immunity. That's a huge part of how our body functions. Poor gut function is almost always due to one of the key certain things. And there's 2 main ones we're going to talk about. We'll touch on a couple minor ones. Number 1, gut function is the result of food sensitivities. And we're going to talk a good bit about that. I know that's the label, and we're going to get to that a good bit. And we're going to talk about some specific sensitivities that we're seeing really common and the research behind them. The other thing that we see that gut problems associate with a whole lot is infections. Now, how do you know if you have a food sensitivity? You know, you may have gone and had a basic panel done and nothing showed up. You know, what about gluten? Okay, what about dairy or soy or egg? Or do you have problems with yeast? Do you have problems digesting certain proteins? And you feel like whatever you eat, you're not quite sure, you know, is it what I had for lunch, for dinner, or 2 weeks ago that it's causing me to have problems? How about gut infections? How do you know if you have an infection? How about healthy bacteria? We should have good levels of bacteria in our body. Now, we talk about, everybody has heard of a probiotic, right? We take probiotics to help build up that good healthy bacteria. But what does the bacteria actually do? Our bacterial levels in our gut are responsible for making something called short chain fatty acids. Now, the name's not important, but what's important is they produce 30% of our energy every day. So if we don't have good bacteria, we're tired and fatigued, and we're not making the energy we need. How about stomach acid levels? Is anybody here on a proton pump inhibitor? Sure, you know, omeprazole, Prevacid, etc. Most patients who have problems with reflux, with GERD, don't have too much stomach acid. Especially if you have a thyroid problem or other issues going on. What you actually have is a condition called hypochlorhydria. It's too low stomach acid. Now, your stomach acid gets low, and when you eat food, especially if it's a problem like a food sensitivity, and you can't digest that food, then your food's just going to sit in your body, and it's what you're actually refluxing. It's not the acid. In fact, if you look and ask your doctor who diagnosed you with reflux, well, did you see acid? How do you know it's acid? They don't. It's just the assumption, and it's what's commonly assumed to be the issue. There are markers in blood that you can look at to see if you're deficient in stomach acid. There are a lot of tests. Apple cider vinegar is a perfect example. If you love apple cider vinegar, you're probably deficient in stomach acid. How about leaky gut syndrome? This is something else that we're going to touch on a little bit as well. Now, leaky gut is a huge missing link with autoimmune disease. But, you know, if you're going to figure this out, you have to test right. And the key thing is, so many doctors don't know what tests to run. So if we talk about food sensitivities, I want to talk about the concept of what is a sensitivity. You know, we've heard of food allergies or food responses or food sensitivities or even with gluten, celiac disease. And you said, well, what's the difference? So a food allergy is a severe reaction to food. We're talking, think peanuts, shellfish, anaphylactic shock. A food reaction is something that's not severe, but you have symptoms. Again, it's something that when you put it in, you notice it almost immediately. A food sensitivity can be something that doesn't impact you right away. And again, we're talking about, you know, you may eat a food today, and then tomorrow you're angry, or you have trouble sleeping. And you don't notice if it's anything that you ate. You know, so those sensitivities, believe it or not, are the exact same in your body as a food reaction. It's just delayed. It's something that doesn't happen today, it happens down the road. It's because your immune system still reacts to it. Your immune system says, I don't like you, I don't want that food in my body, and it's going to have a response that's going to cause that immunity to go create a problem somewhere else. If we talk about gluten sensitivity specifically, the difference between celiac disease and gluten sensitivity really starts with the fact that most patients who have a gluten sensitivity don't know it. There's research, and this is in the British Medical Journal, 1999, that shows that, again, 87% of celiac disease patients have no symptoms, no gut problems at all. The majority of people who have a gluten sensitivity don't know they have it. They have health problems. Their body's not working right, but they cannot associate it directly with something they eat. Gastroenterology, 2001. For every symptomatic patient with celiac disease, there are 8 patients who have celiac disease and no symptoms. What I'm quoting you are established medical journals that are more than a decade old saying that there's a link. Now, if you go to many gastroenterologists today, they're going to send you out of the office saying you do not have a gluten issue. They're going to say it doesn't exist. The research is there. There's no way around it. And if we really talk about gluten sensitivity linked to autoimmune diseases, the first thing I'm going to link is a condition called Hashimoto's. Now, Hashimoto's is what we call autoimmune thyroid disease. We're going to talk about the thyroid again in a second, but with symptomless celiac disease, there's a direct link between Hashimoto's and gluten sensitivity. And actually, even for patients who are on a thyroid medication, and this is a great one, if you take gluten out of your diet, a relatively new study shows that your T4 levels will improve by 49%. So same Synthroid, same level of thyroxine, same dose you're on a prescription, removing gluten is going to make that hormone work better. It's going to make your body need less. Gluten overstimulates the immune system. There's no practical difference between celiac disease and gluten sensitivity. You have the genes are turned on. What that means is your body can respond against gluten. Once that turns on, you may have an antibody that gets released that goes and attacks your thyroid. Again, there's a huge link between thyroid and gluten sensitivity. You may have an antibody that gets turned on and attacks your gut. That's celiac disease. You may have an antibody that gets turned on and attacks your feet. That's peripheral neuropathy. There are even studies that link ALS. There are now 3 case studies linking gluten sensitivity to ALS-like symptoms. And again, this is really interesting because 55 diseases show an association with gluten sensitivity. And if you have an autoimmune disease, it really is a must for you to go gluten-free. That is a huge part. And patients come in and say, you know what, I went gluten-free, I don't feel different. That's okay. As we've tested you, we've seen that you still have a response against it, and that's not the only thing causing your problem. You have this web of dysfunction. But gluten is a piece of the puzzle. So if you remove it, your inflammation drops, and you're going to have less stress on your immune system. That's going to allow everything else to function better. The real problem with gluten sensitivity is testing. There's not good testing that's out there at all. And again, the standard panel, and I hear this, you know, my doctor tested me, did a celiac panel, and told me that I didn't have a problem with it. I was fine. Now what we see is sometimes the values were there, but they weren't bad enough for the doctor to confirm it. But yet you still had the values, which means there was still a progression of a problem. Sometimes you see that they just didn't run the right tests. The standard celiac panel looks at 2 markers, alpha-gliadin and something called tissue transglutaminase, TTG. If those 2 markers come back negative, your docs are going to say you're fine. I use a lab from Cyrex Laboratories. It looks at the other parts of wheat. There are 13 different markers that make up wheat as a whole. And you can have a reaction against wheat, but not alpha-gliadin. Against gluteomorphin, which means that when you eat gluten, it impacts your brain and it makes you get that brain fog, but not alpha-gliadin. So there's all these links that are there, and if you don't run the right test, you're never going to know. The most accurate panel that's currently available is from Cyrex Labs for gluten and other food sensitivities. Array 3 is the one that we look at with those 13 parts, and it looks at several markers that actually associate directly with autoimmunity as well. As far as tissue transglutaminase, that one marker, it actually looks at 7 different tissue transglutaminase markers. So again, there's not just one damage, it could be damage in another part that's impacting you, and we want to know if it's there. But here's the thing, let's say you have a gluten sensitivity and you go gluten-free, and you still have symptoms. There's a term many of you have probably never heard of. It's called gluten cross-reactivity. What research is showing is that up to 13 foods can cross-react in your body. What that means is the amino acid structures are so similar, the proteins are the same, that when you eat that food, your body thinks you're eating gluten. That includes dairy. That includes coffee, yeast, rye, barley, malt, Polish wheat. Those we kind of assume associate with gluten. We also talk about rice and millet and hemp seed. I've also associated with it. Now, the key thing is not everybody has those problems. You may have a cross-reactivity to one food, but not the other ones. But if you have that reactivity, if you have that sensitivity, when you eat that food, then your body's getting damaged and you don't know it, which is why testing is so important. The panel that I use is Cyrex Labs Array number 4. It looks at 26 different foods, a whole bunch of dairy markers. It looks at soy protein, egg protein, oats, even gluten-free. How about corn, rice, potato, tapioca, teff, amaranth, millet, all these other grains that are gluten-free. And you say, okay, I'm gluten-free, what else can I eat? Maybe nothing. We may have to heal the damage because no matter what you put in your body, it's attacking maybe only one food. If we talk about infections, one of the big things that leads to gluten sensitivity are bacterial infections. There's something called H. pylori. There's several ways to test for this, and if you have reflux or ulcers, you got to look for it. How about Klebsiella, E. coli? Bacterial infections are huge and people don't even know them. Parasites. I love sushi. If your immune system is not working well, do not eat sushi. It's raw fish. There are parasites in there. How about Lake Norman, Lake Wylie? Same thing. Again, these are lakes, they're not clean. So if you have an immune system that's compromised, you're going to get the potential of picking up infections from going there, from swimming, or if you travel. So you may have a parasite. The only symptom that you have is you're tired. You may not notice anything else until you're tested. And if you have that infection, we look for yeast, we look for fungi. If you have that infection, we have to get rid of it in order to get your immune system to balance out. Leaky gut syndrome. Has anybody here not heard of leaky gut syndrome? If you haven't heard of it, I want you to raise your hand. Okay. So leaky gut syndrome sounds kind of scary. It's leaky gut. What is that? Basically, it's where your immune system causes a breakdown when you put food in your body, sometimes medications in your body, sometimes hormonal issues or stress issues, and it allows inflammation to get out. Imagine you've got a matrix. That matrix separates and it becomes porous, and your body can break down, and literally you could put something like broccoli in your body and it can create a leaky gut reaction, which is why on an ALCAT test it may show that you're sensitive to broccoli. You don't have a problem with broccoli, you have a leaky gut problem. Research shows that leaky gut syndrome is a prerequisite to autoimmune disease. This is a key piece of the puzzle, and if you look in the integrative literature over the last decade, you're seeing that everybody is heading this way towards addressing leaky gut problems. What happens is you put food in your body, it causes inflammation, that inflammation leads to a breakdown of the lining, and then that breakdown of the lining leads to symptoms that get worse, and antibodies go out and attack your body, and you know what? It starts all over. It's this vicious cycle. So if we're going to get you better, we have to test your leaky gut. And there is a panel. I use Cyrex Labs Array number 2. It looks at 3 causes of leaky gut. Is it autoimmune? Is it inflammatory in food? Or is it bacterial? And we can fix it based on what the cause of it is. So blood sugar. Talk about a second huge cause of your autoimmune disease. Unstable blood sugar. Everybody should be at 85 to 99. If you're not, if it's low, we call that hypoglycemia, and you can see nerves getting damaged in your brain, in your feet, elsewhere. If it's high, we call that diabetes or insulin resistance. 100 to 126 would be insulin resistant. 101 is insulin resistant. So you're borderline, your body is reacting abnormally. If we talk about neuropathy, which is where you have burning in the feet, and again, 20 million Americans have this condition, you look at their feet, they're not on fire, but you feel like it's burning, and you may not have diabetes, but you may have blood sugar that's 105. That's all it needs to affect you. If I'm going to get you better, for maximum results, I have to fix your blood sugar. By the way, blood sugar is one of the 2 things that our brain needs to function, sugar and oxygen. Properly regulated, your brain's going to function well. If it's not regulated, you're going to have poor brain function, and I keep mentioning this, brain fog, anxiety. Anxiety is a huge thing with blood sugar. If anybody's on clonazepam, fix your sugar and you can get off the clonazepam. Adrenal dysfunction. Now the adrenal gland are 2 little glands that sit on top of your kidneys. They are your stress glands. They contribute to how your body reacts to stress. And if you're under stress, your cortisol is going to go high. That's going to impact everything from insulin resistance, to weight gain, to blood sugar imbalances, to brain function. Again, you talk about that brain function. How about sleep problems? Anybody here have trouble sleeping? Sure. So cortisol sets your sleep cycle. It should be high in the morning, low at night. If it's not, then there's a good chance that you're going to have trouble sleeping. And instead of being a normal ratio, you know, your body at night is saying, let's go party when you want to go to sleep. And you got to fix the cortisol imbalance. How about mineral imbalances? So pH levels. You talk about acidity. Now, one of the biggest things we talk about with acidity has to do with cancer, an acid environment for your body to develop. So what can you do to make sure that you don't have that environment for your body to break down and attack itself with? Chronic pain is the other one. With the adrenals, there are hormones that get released, epinephrine, norepinephrine, and they actually will cause pain fibers to fire and hurt you. Now, thyroid is a huge, huge thing that we see. With thyroid dysfunction, you have a bad thyroid, you have a bad brain. And we're talking about hypothyroidism is the majority that we see, but sometimes it could be hyper or Graves' disease as well. A stat for you, if anybody here is hypothyroid and on medication, 90% of hypothyroidism is the result of autoimmune causes. This was published in 1998 in the Journal of Metabolic and Endocrine Disorders, the #1 thyroid journal in the world. If you're hypothyroid, you most likely have Hashimoto's. And your thyroid literally affects everything in your body, and the immune system is attacking it. Now, every single cell in your body has thyroid receptors. It affects your weight, it affects your sleep, it affects your stomach acid, it affects your brain, it affects your nerves. Everything literally gets an impact from your thyroid. There's a book that my patients all read. It's called Why Do I Still Have Thyroid Symptoms When All My Lab Tests Are Normal? My mentor, Dr. Datis Karazian, wrote this book. It's one of the top thyroid experts in the world. It is a great, great book. If you have a metabolic problem or a thyroid problem, get this book. Now, the fifth one is anemia. When I say anemia, I don't mean iron problems. Maybe a little, but really anemia means red blood cell disorder. So it's caused by vitamin and mineral deficiencies, maybe a B6 or B12 problem. It's caused by infections in the gut, all these little microbleeds that occur and lead to blood loss. Talk about menstrual issues, talk about, again, trauma. You're going to have this blood loss occur, but it's also caused by autoimmune diseases. There's something called pernicious anemia, which is where your immune system attacks B12. And there's something that's called anemia of chronic inflammation, which means your body's just broken down. It's not working right. And so your red blood cells aren't functioning the way they're supposed to. If we're going to get your immune system fixed, we have to address anemia as well. Now, if we talk about autoimmune conditions specifically, our immune system mistakenly attacks different parts of our body. It's making what we call autoantibodies, antibodies against our own self. And it can't distinguish between me and something that's really bad and it wants to get rid of. So, common conditions, if I ask the audience to name 5 autoimmune conditions, you guys are going to be hard-pressed to come up with more than 1 or 2. Hashimoto's, MS, rheumatoid, type 1 diabetes, Sjogren's, scleroderma, Guillain-Barré, celiac disease. Again, you talk about a list of a whole bunch of common autoimmune diseases. It really impacts a large percentage of the chronic illnesses that we see in our country. When we talk about your immune system, we have something called Th1 and Th2, 2 halves of our immunity. In a normal, healthy person, your immune system shifts, it fights an infection, then it calms back down. In an autoimmune patient, there's a shift into dominance, and the immune system starts attacking something. I use an analogy. My daughter is 6.5. Imagine she's on a seesaw, okay, at the playground, and a high school football player comes and sits on the other side. What's going to happen to her? She's going to go flying, right? That's your immune system when you're autoimmune. And what we have to do is address why it's being pushed into that dominance, and what can we do to remove that, and then make that base, make that seesaw base wider, so when the immune system gets rocked, it doesn't cause a huge shift. We call that a Th1 dominance or a Th2 dominance in your immune system. If you're autoimmune against one tissue, so if we talk about thyroid and Hashimoto's or celiac disease, most likely you're autoimmune against other tissues. There is a panel that we now have available. Cyrex Labs has this immune panel. It looks at 24 autoimmune predictive antibodies. With this panel, we can tell if a patient is leaning towards rheumatoid, MS, rheumatic heart fever, pernicious anemia, diabetes, Hashimoto's, cerebellar ataxia, Alzheimer's, all those conditions with one panel. If we have autoimmune diseases, it is an amazing, amazing test to tell us where your immune system is attacking. Now, how many of you have been told your lab tests are normal? Sure. So your doctors are running blood work, and I use the same labs they do in my office, Quest, Solstice, LabCorp, and I get that lab back, and it tells me a reference range. That reference range actually has nothing to do with where you should be. It's statistics. Now, if you think about who gets blood work done every month, is not a healthy person. It's a sick person. You go every month because you have an illness and you're getting blood work done. Those statistics go into a pool, and then a bell curve is established, and that's where your reference ranges come from. They're not published in the medical literature. They're established by each individual lab, and literally they can change from here to San Diego to Chicago to New York to Dallas. You can have different ranges for the same test, and we're all American, we're all humans, so why is it really different? A lot of times your doctors say there's nothing wrong because you're within that reference range. If you're outside of that range, there's definitely a problem, but just because you're within that range, congratulations, you're as healthy as everybody who's sick. We just don't know what's going on with you. Many times your doctors aren't running the right tests, so we got to make sure that we're running those right tests, or they're using those traditional lab ranges. You know, and again, one more time, the traditional lab ranges are so broad. We do use functional lab values in functional medicine that are actually published in the medical literature. They're optimal. It's where your body should be. The American Association of Clinical Chemists is one of the groups that publishes them. There's a couple other big groups that publish these ranges, and by using those ranges, we can make sure that you're here in the functional lab range and not out here in that little range in between. So you're not H, you're not L, but you're also not borderline. You know, because you're not going to have anything done if your doctor says you're borderline and I'll see you in 6 months. You know, take liver disease. Patients say, hey, I have liver disease. Okay, what is your doctor doing to help your liver? He tested it. He said he'll see me in 6 months. No, what is he doing to help fix it? He tested it. He'll see me in 6 months. That's what you get with this system. If we talk about TSH in thyroid, the optimal functional range, 1.8 to 3.0. This is where your TSH level should be with every patient all the time. If you're not there, you have a thyroid problem. And just to show you how much these labs are an issue, taking that value, if I take 8,000 endocrinologists, the thyroid experts, they published in 2003 that the range should be 0.3 to 3.0. So even the endocrinologists say, you know, above 3 is too high, it doesn't work. The point is, if you want to see normal, bring your lawn chair, go to a public festival, sit down and see all the unhealthy Americans sitting around. I don't want you to be normal, I want you to be healthy. The goal is to get you where your body needs to be, not just a statistic. The medical approach is going to wait until tissue destruction is so far gone and then squash the entire immune system with steroids. Take an antidepressant. It'll make you feel better. You still have the problem, take an antidepressant. How about give you symptom management with pills, but don't fix or address the underlying chronic causes? A functional medicine approach is, let's look at these 6 different areas. Let's look at these other areas that impact why your immune system is attacking. Remove those immune triggers. If you have food sensitivities, we have to identify and remove them. If you have leaky gut, we have to fix it. If you have infections, we have to kill the infection. If you have blood sugar, we have to balance it. If you have adrenal or hormonal issues, we have to correct them. Your liver, gallbladder, all this has to be fixed. How about supplements that you're taking that make your problem worse? If your problems get worse from supplements, the issue is half the things you're taking are making you worse, half are making you better. I mean, I have patients that bring in a bag, 24, 25 supplements, and almost all of them, they think you're helping them, but they're not. They're actually pushing their immune system the wrong way. In my office, I do what's called a neurometabolic approach. We modulate the immune system, we use diet and lifestyle, and targeted supplements based on what your lab work shows and you need. We address the neurological misfiring and brain function issues. And we look at the whole person, not just one individual little section. Now, life is a matter of choices. I told you guys at the beginning, my goal here was to reinvent your life. Hopefully I've done that a little bit with the information that I've shared with you. We do workshops in my office, we give you a lot more information, and when I work with my patients one-on-one, we really help educate you to understand how your body is working. I want you guys to ask yourself a couple questions. What can improve with your condition if you decide to take a functional medicine approach and do something to fix the problems we've talked about? But more importantly, if you decide to not address these issues, where do you see yourself in 3 years, in 5 years? If you want to see improvement, if you want to get to the bottom of your chronic health problem, talk with us more about what you're dealing with and see if there is a solution that's available from an integrative and functional medicine perspective. I thank you very much.